We're very fortunate today to have a special guest for this interview recording, and I'm pleased to introduce to you Dr. Robert Weber. Dr. Weber is the Senior Director of the Pharmacy Services in our medical center on campus. So Bob, thanks for being here.
Thank you very much for having me, Ken.
And Bob, so as you know, this is the final week of our course, and we're thinking about contemporary issues and the future of the field. So I want to think with you a little bit about where we're headed.
Sure.
And you've been very active and as a leader in academic medical centers. You've been very active in our National Association, ASHP, which our students have learned about. You've been particularly involved in things like medication safety and ASHP's pharmacy practice model initiative. So you've been kind of helping to formulate where we are now, where we can move ahead. So just a simple question to start. Where do you think we're headed in hospital pharmacy practice?
Well, Ken, I think where we're headed is pharmacists being more active, independent members of our healthcare team. There are things that are done every day for patients that pharmacists have to get permission to do those things. Changing a patient's therapy from intravenous to oral. Changing a dosage of an antibiotic. Those are things that in the future pharmacists will be doing more independently, more like individual practitioners do now currently in the medical model. So where I see pharmacy practice going is to a more independent model that is very interdisciplinary. So the pharmacist will have very specific duties, very specific patient care responsibilities as part of a team. But these responsibilities and duties will not necessarily be monitored by the medical team like they are in the past. The pharmacist will be responsible for doing those independently and at a very high level of quality.
Mm-hmm. So more of an independent practice embedded within a healthcare team and a collaborative practice model.
Exactly. And so what that's going to require is pharmacy students to, number one, have the right training. Mm-hmm. So residencies is going to be critical for our students to be able to get those skills. Confidence on the patient care team, which obviously comes from training and mentoring, is going to be critical because as a member of that team, you'll be making decisions about patients that you need to be confident and competent. And also, finally, just understanding what your role is on the team and making sure that role is clarified, that everyone on the team knows that the pharmacist is a part of the team handling specific patient care functions on a daily basis, and that if the pharmacist isn't there, there's a gap. And that's really what we want. We want for our healthcare team to say, where's the pharmacist today? If the pharmacist isn't there, there should be a notable gap in that patient's care and patient's treatment. That's really where we want it to be in the future.
Gotcha. Well, so you've given us, and maybe you've already answered this question that I'm going to ask you next, but you talked about being independent practitioners, part of a team, and confidence and to do all the things we need to do. But could we drill down a little bit and say, more specifically, even 25 years from now, let's say, if somebody watching this video finds themselves as a practitioner in a medical center or in any kind of hospital setting, I mean, what kind of things do you think they might be doing on a day-to-day basis?
It's a great question. I think that at the Medical Center at Ohio State, we try to think ahead. We try to think in a forward way so that we try to have a practice model that's about 10 or 15 years ahead of where everybody else is. So I think we have a pretty good idea as to what they'll be doing. I can tell you that what they'll almost always be doing is adjusting patients' medication therapy based on the patient's needs, based on their body function, based on patient compliance, based on their disease state. They'll be independently adjusting medication dosages. They'll be going in every day and looking at a patient and saying this patient's renal function has changed, this patient's physical status has changed, and as a pharmacist I'm making an independent decision to change that medicine for that patient to improve their quality of life. So I see them adjusting medications. I see them educating patients about their medicines, making sure that patients almost always know the major side effects of their medicines and what to do when they experience a side effect. I see them educating the healthcare team. So I see them going in and having impromptu education sessions, saying, okay, we have a patient on our service today who has an adverse effect to anticoagulation. I'm going to spend 10 minutes and talk to the team about how do we manage anticoagulation safely in those patients. So a role of medication management, meaning sort of day-to-day adjusting medicines based on the patient's needs. Education of our healthcare team. As well as, and finally, what's important is understanding how the patient's home life and how their home care will affects their hospital stay, and understanding and managing those transitions of care. You and I did a talk several years ago on managing transitions of care, and I think that is very critical now, in that as patients transition to the home, making sure they have their medicine, making sure they understand how to take it, making sure that it's properly managed at home and transition smoothly from a hospital will be an important role of our pharmacists.
You've hit many things we've talked about throughout this course. So we've talked about residencies, and we've talked about collaborative care and transitions of care, and medication safety, all the things you're talking about, medication therapy management. So it sounds like we've been hitting the right things. Maybe that seems to be the direction we're heading. So I wonder, as we think about the way we use medications today, and we've talked in our course about the progression, the evolution of pharmacy, and how drugs have evolved and how the practice has evolved. And we use medicines a certain way right now. But do you have any kind of a vision for in the future? I mean, how might we fundamentally use medications differently, do you think?
Well, I mean, that's again a great question, and one of the things that we've, as a profession, talked about is the whole personalized medicine, pharmacogenomics, pharmacogenetics, tailoring medication therapy to meet the genetic variances of different people. I think that's going to be a focus and a study in the next 10 years, and I think after 10 years from now we'll know better how to do that. The biggest issue that is preventing us from really being very aggressive with pharmacogenomics or genetics is cost. The tests are expensive. They're not available everywhere. People may not understand how to use the result of a genetic test to change a medication therapy. So as we grow over the next 10 years, I think we'll use medicines differently. Ultimately, we will probably end up where we will use the patient's genetic code, the genetic sort of picture of a patient, to adjust medicines. I think another way that we will use medicines differently is we will have more oral medicines to combat certain serious diseases where we use intravenous medicines now. So cancer is an example of that. There are oral chemotherapy drugs that are used to treat cancer effectively. There was recently a study published at the medical center showed that an oral medicine for chemo was very helpful to treat leukemia, which we know is often treated using intravenous medicines. So it poses a whole new challenge for us in terms of monitoring patients for side effects, making sure patients qualify to get these expensive medicines, because many of these oral medicines are very expensive. And then obviously saving money for our healthcare system because we're not using intravenous medicine. So I think you'll see more medicines being used orally, and I think you'll see more medicines being individually dosed based on a person's genetic code.
Yeah, interesting. Well, the final question I have for you, Bob, is you've laid out some interesting thoughts in terms of where we're headed. If I'm someone watching this video and I want to maybe enter this profession and I aspire to work in a place like you do, what kind of advice do you have for those people who might be wanting to do a hospital pharmacy-based practice in the future?
Well, I was actually asked this question by a college student who's entering first year of college, and I thought about it for a while. I think the factors that make students successful pharmacists is, number one, a degree of maturity. So being raised and being responsible in your life as a teenager, being responsible as a college student translates to being responsible as a professional and as a pharmacist. So personal responsibility and accountability is probably the key characteristic that I say folks should have to be successful in the profession of pharmacy. I think a knowledge of science and chemistry is important, but something that's more important and something that I think is often missed is a knowledge of communication and a knowledge of interpersonal relationships. So somebody who is mature, responsible, accountable, and can talk to people is the person who will be a successful pharmacist 25 years from now. Even now, actually. That's what we look for now, right? We look for students who assume personal responsibility and accountability, who can speak and communicate with their peers and patients, who are knowledgeable about the profession, and who are committed to quality and safety. So that's what I see as a key characteristics of a successful pharmacist in the future.
So you're optimistic about the future?
I am always optimistic about the future. I always tell people after I get done going to graduations, I always tell people that I'm confident that the profession is in good hands, because I honestly do think that our students are the best of the best, and I'm confident when I see them leave here, even our residents and our students, that they certainly will take care of our patients and our profession. And I'm very confident in the future of our profession.
Well, we really appreciate you being with us.
Thank you for having me.
Yeah, it's been a pleasure.
Same here, Ken. Thank you.